This is going to be a short video on looking up the ARRT content specifications, and hopefully this is going to be pretty straightforward and with me not making a whole lot of mistakes along the way. Okay, so let's take a look here. I've just opened up Firefox, but you can use any old browser, it doesn't really matter. And up here in the address box, I'm going to type in arrt.org. I guess I could have just left it all lowercase. And we're waiting. Okay, cool. Here we are, arrt.org. And over here, in the very, kind of like over on the right-hand side, we got this magnifying glass, so we're going to search. And we're going to put in here radiography, content, and that's probably enough. I'm going to put radiography content specifications and then click on search. Okay, and eventually got my search results. And okay, vascular interventional, no, don't want that. Limited scope, don't want that. Vascular sonography. Okay, so let's click on ARRT reference documentation by discipline. And we'll look down through here. Okay, we don't want bone densitometry or sonography or CT. And we're going to look down through here. Oh, here we go, finally. Radiography. Now, clinical competency, we want to see exam content specifications. We want to know exactly what we're going to be asked. Okay, so here it goes. And I think this is just a PDF document, so you can download it if you want to. And so we're going to look, and it tells us, okay, we're going to have 33 questions on patient care, 53 on radiation safety, 50 referring to image production, and then 64 procedures. And that includes your positioning and, being able to describe what's supposed to be on the x-rays. And if you look through here, it goes into detail. So in patient care, don't forget to remember like those patient's rights, informed consent, HIPAA, patient care bill of rights, all that legal stuff. You remember that stuff, respondeat superior, res ipsa loquitur, they want you to know all that. And if we keep going down through here, more patient care, pharmacology, all the stuff that we went over back in RAD 110. Radiation physics, radiation safety, radiation protection. I mean, there's a bunch of stuff in here on radiation protection. It tells you which of these NCRP reports you're going to be asked about. Looks like 102 and 116 are the main ones they're interested in for the time being. Image production. Okay, remember this chart. Mass affects your image exposure, but not your contrast, nor spatial resolution, nor distortion. KVP affects exposure and contrast, and so make sure you know all this stuff. Technique charts, anatomically programmed at the APR. How to do measurements with calipers and variable KVP, they might ask you about that. So remember, for variable KVP, for every centimeter of tissue that you add, you have to go up 2 kVp. And over here are some of these acronyms. Modulation transfer function, detective quantum efficiency, SNR, CNR, detector elements. I've tried to kind of go over a lot of that stuff with you guys recently to refresh your memory. Image production. Okay, how does your equipment work? X-ray generator, transformers. Remember the phasing, 3-phase, single phase, pulsing. Each one of these different each one of these different kinds of generators has pulse and frequency attached to it. And most of the stuff we have nowadays is high frequency, but you may be asked about an old 6-pulse generator. That's entirely within their purview. Remember DICOM. Values of interest. I think I covered that on one of those videos. The lookup table, which is a database of what different images are supposed to look like for different parts of the body. The region of interest. That's just the area that you're focusing on when you're taking an x-ray. That's the part of the body that you're trying to demonstrate for the radiologist. There's a bunch of stuff in here. My recommendation is to go through this and just make sure you know what each of these items is. And if you don't remember it, look it up in your notes, or look it up in the book. And like I said, I've tried to cover as much of this stuff with you guys as I can, but there is a lot to cover.